Hello and welcome to Innovations, a podcast series brought to you by the experts at Sanford Health. You're listening to our 19th episode, A Connection to Fight Cancer. I'm your host, Simon Floss with Sanford Health News. The practice of medicine goes far beyond clinic walls. The Innovations podcast looks at the biggest issues facing healthcare today. Each one of these episodes offers the opportunity to see the ever-changing world of health and wellness through new eyes. Our leaders offer out-of-the-box solutions to some nagging questions. Today, we are talking about a disease that's affected everybody in one way or another, cancer. Recently, Sanford Health has become heavily involved with the Connect for Cancer Prevention study, a research study from the National Cancer Institute aimed at better understanding the causes of cancer and how to prevent it. Here to help explain what we need to know is a distinguished panel of guests. Chun-Hung Chan, Deanna Whitty, and Amanda Mensing. Dr. Chan and Amanda are joining us from Sioux Falls, and Deanna Whitty is joining us from Fargo. Thank you all so much for being here today.
Thank you.
Thank you.
Thanks for having us.
We'll get right to it because this is a big topic with a lot to unpack. Chung, we'll first start with you. What exactly is the Connect study?
So the Connect study is a new innovative study that the National Cancer Institute has started that basically is looking at causes of cancer and developing a new resource for researchers nationwide to basically look at things like how your lifestyle or where you lived and your genetics and other factors might affect your risk for developing cancer. And the goal really is to identify these new potential risks and help prevent cancer.
Amanda, if someone was going to ask you why this study is important, what would you say?
Well, I would say that the study is one of the first that enrolls people before they ever get cancer. I know a lot of research studies focus on patients when they get cancer, whereas this one looks at people before with no indication that they would get cancer. We're also looking at, as Chun said, environmental factors such as where a person grew up, where they currently live, where they work, any social factors, and their lifestyle choices in terms of how that could lead them to either develop or not develop cancer later on.
So this is just incredibly useful.
Exactly.
Deanne, in your mind, what's the most unique thing about the Connect study?
I think for the most part, it's such a large study. They're looking to enroll up to 200,000 people, and it's a long-term study over the course of at least 10 plus years of healthy individuals. Most of the studies, as Amanda said, deal with treatments rather than trying to find the cause. So this is kind of, in my mind, what would be the most unique thing, I guess.
Chun, how did Sanford Health become a part of this study?
So through my work with the Sanford Biobank, I got to know the folks at the National Cancer Institute. And many years ago, they invited me to present to them on what we do at Sanford as far as research and biobanking is concerned. And then that led to them inviting us to submit an application to participate in this study. And we were successful in being awarded that contract, and that's how we got here.
What was that experience like? I mean, one, being asked to present that, and then two, just having that direct connection with the Institute.
It was actually a interesting experience in the sense that I was not expecting them to reach out to us. Generally, in research, normally we look for the funding opportunities, but in this case, the NCI actually directly approached us, which was unexpected, but also quite an honor, I think, for us. I think obviously whatever we were doing here, they were impressed with and saw the value of including Sanford Health in this important new study. And I think that definitely having those relationships with the National Cancer Institute and the leadership there definitely benefited us.
You know, the old expression, don't call us, we'll call you. They actually called us,
yes.
So
Yep.
What's that say about Sanford Health in general?
I think that basically says that, Sanford Health is starting to become recognized as a leader in research.
Amanda, how can a person join the study?
So there's a few different ways that we're looking for participants. If someone is eligible, they may get an invitation from Sanford Research through either MyChart or also in the mail. Otherwise, we do welcome people to go to the website for the study, cancer.gov/connectstudy. And then we're also going to be placing posters, working on recruitment there. We're going to be working with some of our Sanford physicians to see how they can get their patients involved as well.
Why would you recommend that someone get involved and join the study?
I think this is a really unique opportunity to be able to input the way a person, chooses to, live as far as social life or location, and provide that information and just basically give it as a bank to try to help our future generations try to find potential causes of cancer that we may not have even thought of.
Sure. And speaking of, potential causes, these outliers as far as the study, where someone lives, their genetics, just a reminder for people listening, what are some of the, the biggest causes, if you will, or just those outer layers that might contribute to a cancer diagnosis later in life?
Yeah, I think a lot of what people think of right now are causes of cancer are the obvious ones, smoking for one. Mm-hmm. So this is really looking at, is where you live a potential, do you have a higher risk depending on what part of the country you live in, which I think is the main reason that it's so important that we're working with so many different locations throughout the country, is we can try to determine that.
How many locations? Sorry to interrupt. If you have a ballpark number, too.
We have 9 right now, I believe. Am I right on that, Chun?
Yeah, Sanford is one of 9 institutions nationwide that are working together to recruit for the study.
And I'm assuming it's like you said, nationwide, coast to coast, Midwest, down south.
Yes, there are representation from the East Coast, the Midwest, the Pacific Northwest. We even have a location in Hawaii.
Well, aloha. Deanne, say a person wants to join the study. What are some things that they need to know? What's going to be expected of them, and what are the responsibilities of participants?
After you consent and join the study, you'll just be asked to complete a variety of questions in the form of surveys, answering questions about your health history, environmental questions about where you work and live, among others, of course. Just all background information that might help assist researchers in the long run as far as looking back. You'll be asked to make an appointment to complete sample collection of blood, urine, and saliva. And after that first initial round of survey and sample collection, participants will be contacted periodically to complete additional surveys and provide additional sample collections.
And you said this is, a long study, 10 years plus. What's kind of the time frame on that again?
A time frame on the biospecimen collection?
No, just the length of the study.
Chun, maybe you could answer that better than I could. I know 10 plus years as far as following people in the age group more likely to develop cancer, I guess.
Sure, Chun, if you want to take that.
As designed right now with the study, the NCI are hoping to follow participants for at least 10 years, with the idea that over the course of those 10 years, and with the age group that we're actually looking at, between the ages of 40 and 65, based on national statistics, they would expect a proportion of them to develop cancer during that 10-year period. However, the NCI have also indicated to us that if this study is a success in terms of recruitment, that they would actually consider extending it beyond 10 years and possibly up to 20 years in length. And this will really be, probably the most comprehensive study for looking at the causes of cancer anywhere in the world, because most studies generally do not do a long-term 10 to 20-year follow-up.
Wow. What information will be collected from a person, and then how will it be used?
So in addition to the survey questions that Deanne mentioned, we will also ask participants to give us permission to access their medical records. So Sanford will provide medical record information to the NCI that will be associated with the survey questions, as well as the samples that have been collected. And all of this information will be collated together, and then they will also draw upon additional information, such as geographic location. So they may look at things like particularly in the Midwest, they might look at the type of industry that occurs around here. So obviously in the Midwest, there's a lot of farming. So they might look at farming and potential exposures to agricultural chemicals, and then tie that back with where you actually live, and see whether there's a potential that you were exposed to some sort of pesticide or something like that, and if there's maybe a link between that and developing cancer. So really, they're using a variety of different information, as well as the information that we provide and that the participant provides themselves, to really get a comprehensive picture of, what is it that the participant may have been exposed to at some point that may result in developing cancer.
This is just fascinating. Amanda, what are the benefits of joining Connect?
So in terms of direct benefits, there's not really any direct benefits to the participant, but overall we're looking at a benefit to the general knowledge of cancer in terms of how it could develop, and that could impact future generations and help prevent cancer by determining causes and the risks associated with it. So much of it is a long-term impact, and looking at doing a study that could impact future generations and the participants' children or grandchildren.
Deanne, say that there's someone with no history of cancer. What would compel them to participate in the study, or why should they still participate?
More than likely, someone has been touched somehow by cancer, whether it be through a relative or a close friend or a coworker. We all kind of know people that have had to go through cancer treatment, and this is a way for those people to feel like they're helping and feel like they're contributing to the cause. And I think that's it's a feel-good way of saying that, you know what, I'm involved in this. I'm gonna try to help in whatever way I can.
And like you said, cancer truly has impacted everyone in one way or another. Chun, how is this study impacted if a participant develops cancer?
So if a participant develops cancer, it will actually not impact the study in the sense that the participants can still continue to be part of the study. The sad reality is that out of the 200,000 people that they hope to enroll, a proportion of them will probably develop cancer in their lifetime, and that's actually one of the kind of goals of the study, is that they want to look at those people who do go on and develop cancer, because then the NCI will actually have kind of like a before and after picture of what does that participant look like, before they develop cancer and then after they develop cancer, what the NCI are really hoping to do is work with Sanford and identify those participants that do go on to develop cancer, and then we will provide them with additional information from their medical records, treatment information, maybe some samples from pathology, so that they can really study what type of cancer the participant has developed, and link that back to any kind of potential pre-cancer data that they have in terms of exposures, and really see if there's any sort of link there between what they might have been exposed to, or genetics, or things like that, and the cancer that they end up developing. So, like I said, this is really a comparison of before and after, and they do actually, expect a number of participants to develop cancer in order for them to be able to study those risk factors.
Deanne and Amanda, I'll ask you both the same question and allow both of you to respond. Deanne, we'll first start with you. Why should the study matter to Sanford providers?
I think that for providers, some of our providers work in research and some don't, but it's a way for them to refer people to a study that could benefit them and down the road and contribute to their knowledge and maybe changing the course of their treatments or their treatment decisions, making changes down the road for people rather than just thinking about the here and now, like what are we treating particular cancers with now, more so looking like how can that change by looking back at these things and maybe just making strides to make that better for people.
Amanda?
Yeah, so what we learned from this study could help provide new insights into risk factors for developing cancer, as we've said. And that could definitely help providers in the future by giving them new tools and insights to prevent cancer. And then it could also assist in new screening guidelines. I know the screening guidelines for particular types of cancer seem to change quite often. And this could kind of give providers a little better direction as far as what the best screening guidelines are.
Awesome. Well, thank all three of you for taking the time and joining us here today.
Thank you.
Thank you.
Before we wrap up, I'd like to remind you that Sanford Health Innovations podcast is now available on your favorite podcast apps like Apple and Spotify, as well as our website, Sanford Health News. If you enjoyed this conversation, follow us, give us a thumbs up, and share your comments. We love hearing from you and hope that you find these conversations insightful. Thanks again for listening. I'm Simon Floss with Sanford Health News.